I am Alina.
I am Ardra. Today we are going to discuss about the Unit 8, Introduction to Infection Control in Clinical Settings Infection, and Unit 10, Promoting Safety in Healthcare Environment. These two units we are going to discuss.
So our first chapter is Unit 8, Introduction to Infection Control in Clinical Settings of Infection. The topics are nature of infection, chain of infection, types of infection, stages of infection, factors increasing susceptibility to infection, body defense against infection, and inflammatory response and immune response, healthcare associated infection or nosocomial infection. In that, introductory concept of asepsis, medical and surgical asepsis we are studying. In that, precautions include hand hygiene, hand washing and use of hand rub, use of personal protective equipment and standard precaution, and last one is biomedical waste management, its type, hospital waste, waste segregation and hazards. These are the topics we are going to discuss in this chapter.
So first one, nature of infection. First, types: bacterial, viral, fungal and parasitic. These are the main types of infections. Then characteristics: local or systemic, acute or chronic, and primary or secondary. Then factors influencing in infection: pathogen virulence, host immunity, environmental factors. These are the factors influencing nature of infection. Then chain of infection, how the infection will spread in our body. First one is infectious agent. What are the infectious agent? In that, including bacteria, virus, etc. Then reservoir, where the pathogen lives. The pathogen lives in human, animal environments. Then portal of exit, how the pathogen leaves the reservoir. In examples, respiratory secretions. So next one is mode of transmission, how the pathogen separate. How the pathogen separate from our body. Examples, contact, airborne. These two ways the pathogens can spread in our body. Then portal of entry, how the entry. Then how the pathogen enters the host. Example, inhalation and ingestion. Then susceptible host, person at risk of infection. These are the things coming under the chain of infection.
So next topics are types of infection and stages of infection. First one is type of infection. In that first one, local infection. Local infection means confined to a specific area. The pathogen or bacteria only lives in a specific area or specific part of the body. Example, skin wounds. Second one, systemic infection. It means spread throughout the body. The infection will be spread throughout our body. The next one is acute infection. It means acute, we already know, it is a sudden onset and short duration. It will be occur in a short duration and is occurred in a suddenly it will be occur. Next one is chronic infection. It means it is long term and persistent. We can take the example of TB. Next one, nosocomial infection. It means hospital acquired infection. The infection may occur in the hospitalization and the long term stay in the hospital. Next one is community acquired infection. It means contracted outside the hospital. Example, common cold. The next one is stages of infection. Stages of infection means first one is incubation period. Incubation period means pathogen enters the host and starts multiplying. It means the pathogen, the virus or bacteria will be enter into our body and start multiplying the bacteria in our body, and there is no symptoms in the incubation period. Next, the second stage is prodromal stage. It means early symptoms appear. Before the occurrence or before the disease condition occur, but it becomes severe. Before the severity of the disease condition, the symptoms will be appears in our body. Example is fatigue and headache is the example. The third stage is acute stage. Acute stage means symptoms peak, pathogen is most active. In this stage, the pathogen, the bacteria or the virus is most activated in this time, and the symptoms last in severity. The symptoms will be at the peak. Next one is convalescent stage. It means recovery begins and symptoms subside. In the fourth stage, the recovery will be started and the symptoms will be reduced. The last stage is resolution. Resolution means infection is cleared, host recovers. The host is a human. Human is recovered from the disease and the infection will be cleared. This is the stages of infection.
Next one is factors increasing susceptibility to infection. In that first one is weakened immune system. In weakened immune system, example ആയിട്ട് വരുന്നത് HIV or AIDS immunosuppressive therapy. These are the two examples coming under the weakened immune system. Then age. Age include elderly or very young people. Then malnutrition. In that include poor diet, deficiencies, example vitamin D or zinc. Then chronic illness, example diabetes, kidney disease. Then poor hygiene, inadequate hand washing, sanitation. If we are doing a inadequate hand washing or sanitation, it will increase the susceptibility of infection. Then environmental factors including exposure to pollutants and contaminated water. These are the factors increasing susceptibility to infection. Then body defense against infection, inflammatory response and immune response. In that first one, inflammatory response, how the body defends against the infection in inflammatory response. First one is immediate reaction to injury or infection. If our body will get a injury or infection, in the inflammatory response way, the body will react immediately. Then increased blood flow, white blood cells arrive. Then symptoms like redness, swelling, heat, pain. These are the symptoms will come in our body by the inflammatory response. Then second one is immune response. In immune response, specific defense against pathogens. It is one of the specific defense against the pathogen. Then it involves lymphocytes like T cells, B cells. Then produces antibodies, cell mediated response. These are the immune response coming under the body defense against infection.
Next one is healthcare associated infection or nosocomial infection. Nosocomial infection means it is occurring in the long time of the hospital stay. The nosocomial infection will be occurring at the admission time of the patient. There is no secondary infection to the patient, or after the discharge or after the 48 hours of admission, the nosocomial infection will be occurring in the patients. Infection occurred in hospital healthcare settings, example hospital clinics also. The common type of the infections are urinary tract infection, surgical site infections, pneumonia and bloodstream infections are the common type of infection of the nosocomial infection. The examples of the nosocomial infection. Next one, causes. What are the causes of nosocomial infection? These are poor hand hygiene, because of the poor hand hygiene and the contaminated equipment, invasive devices, weakened immune system. Because of these causes, the nosocomial infection or the healthcare associated infection will be occurring.
Next one is introductory concepts of asepsis, medical and surgical asepsis. First one is precaution. Under that precaution will come hand hygiene. Hand hygiene means it refers to the practice of cleaning one's hand to prevent the spread of infection, typically through washing with soap and water or using hand sanitizer. We are using the hand washing to prevent the infection to don't affect our body. Then we are using the soap, water and sanitizer to wash our hands. Then when to wash? First point, before touching a patient. We need to wash our hands before touching a patient. Then before clean or aseptic procedures, after body fluid exposure, after touching a patient, after touching patient surroundings. These are the things coming under the when to wash. After we doing this, all the things we need to wash. Before doing also, we need to wash our hands. Then how to wash? How to wash our hands? First one is use soap and water in 20 seconds. Second point, use hand sanitizer in 60% alcohol including sanitizer if no visible dirt. Then why it matters, if we see, prevents spread of pathogens. It helps to prevent the spread of pathogens, like protects patients and healthcare workers with using the hand washing. These are the things coming under precaution.
The next topic is hand washing and uses of hand rub. First one is hand washing. Hand washing means we have to be removing the unwanted or contaminated substances from our hand. Hand washing means use soap and water. Hand washing, do the hand washing with the soap and water. Rub hands together for 20 seconds. The time period is 20 seconds. Rinse thoroughly and dry it clean towel. Only using the clean towel for dry our hands. Next one, hand rub. Hand rub means using the sanitizer. Use 60% alcohol based sanitizer. Using the alcohol content in the sanitizer is 60%. Apply enough to cover hands. Rub until dry. Rub the hands with the sanitizer until it will dry. And when to use the each, when to use the soap and water is using in the time of any visible dirt in our hands and the blood, body fluids, or after using the toilets. These times we are washing the hands with using the soap and water. The next one is hand sanitizer. Hand sanitizer, when the soap and water are not available, at the time of the soap and water is not available, at the time we can use the hand sanitizer for the hand washing, for the cleaning the hands.
Next one is use of personal protective equipments. The first one is types. In that undercoming, gloves protects hands from pathogens. If we are using the gloves, it helps to protect against the pathogen our hands. Then mask protect respiratory tract. Then gown protects clothing and skin. Last one, eye protection. It helps to protect eyes from splashes. These are the types coming under personal protective equipments. Then when to use. First one, contact with patients having airborne disease, like example TB. If we are contacting with a TB patient, we need to use the proper protective equipments. Then contact with bodily fluids. Last one is surgical procedures. Then key is proper use. In that undercoming, done before entering patient's room. We need to done this procedure before coming the patient's room and doff carefully to avoid contamination. These are the things coming under use of personal protective equipments.
Our next topic is standard precautions. Standard precaution means standard precautions are a set of infection control practices used to prevent transmission of infectious agents in healthcare settings. We are using the standard precaution for preventing the transmission of infectious diseases from one person to another, and in the hospital care settings applied to all patients regardless of their diagnosis or presumed infection status. We are using the personal protective equipment, and the standard precaution is also be used for preventing the transmission of infectious agents and spreading of the any diseases. That because of that we are using the standard precautions. Then principles of standard precaution means assume every patient is potentially infectious and use barriers. Barriers means personal protective equipment to prevent contact with the infectious agent. Use the personal protective equipment for preventing the spreading of the diseases, and practice hand hygiene. Before and after the every procedure we need to wash our hands and make the hand hygiene properly. Safely handle and dispose of sharps and waste. The used sharps and waste are safely handle and dispose in the according to the guidelines. And the uses of standard precautions are prevent transmission of bloodborne pathogens. It is used for the prevention of any bloodborne pathogens. Prevention time we are using the standard precautions. Examples we can take the HIV. Then reduce the risk of healthcare associated infections and protect health workers and patients. The standard precautions also used by the user for healthcare workers and also used in patients for protect from the spreading of the infection. These are the standard precaution. The standard precaution and the personal protective equipment is the 10 mark question for your exam. So take the notes and study properly. The more notes are available in our Nursing Guru app.
Next one is biomedical waste management. In that, types of hospital waste, waste segregations and hazards. First one, types of hospital waste. First one, infectious waste. Example, used gloves, swabs. That are coming under the infectious waste. Next one is sharps. Example, needles, syringe. Then pharmaceutical waste. Then chemical waste, radioactive waste, general waste. General waste, example, food and paper. These are the main types of hospital waste coming under the biomedical waste management. Next, waste secretion. Waste secretion means separate waste at source. So, with using source, we need to separate the waste. Example, color coded bins. If we will get yellow, white, red, like that, bins are there in hospital. So, we need to separate the waste by their source. Then, label and store properly. Next one is hazards. In hazards under coming infection, transmission, chemical exposure, sharps, injuries and environmental pollution. These are the things coming under the hazards.
Our next topic, next unit is unit 10, promoting safety in healthcare environment. In that the topics are physical environment. In physical environment we are studying the temperature, humidity, noise, ventilation, light, odor and pest control. These are the topics in physical environment. The next second topic is reduction of physical hazards, fire and accidents. Then fall of risk assessment, role of nurses in providing safe and clean environment. And we are studying the safety devices like restraints, in restraints types, their purposes, indications and all we are studying. Then skill and practice guidelines, other safety devices like side rails, grabbers, ambu alarms, non-skid slippers. These are the topics we are going to studying in this unit, unit 10, promoting safety in healthcare environment.
In that, physical environment like temperature, humidity, noise, ventilation, light, odor, pest control. These are the things we going to check. First one is temperature. Temperature comfortable range is 20 to 25 degree Celsius. Then humidity ideal is 30 to 60%. Noise keep it below 45 decibels. Then ventilation ensures good airflow like 6 to 12 air changes per hour. Then light adequate lighting, avoid glare. Then odor, minimize unpleasant smells, use air purifiers if needed. The last one is pest control. In that, regular checks, seal entry points, use traps or repellent. These are the physical environment, temperature, humidity, noise, ventilation, light, odor, pest control.
The next topic is reduction of physical hazards like fire and accidents. First one is fire prevention. Fire prevention means regular check on electrical equipment, regularly inspect and frequently inspect the electrical equipments for any loose connection is there, any short circuit is there or not. That's why we are regularly check the electrical equipments in the hospital. And no smoking policies. No smoking policies is a rule in the hospital. We take because of avoiding then say any secondary hand smoke like that infections. For that we are taking the non-smoking policies in the hospitals. Fire extinguishers handy and check regularly. It will check regularly and it's properly with it's regularly checked and properly checked it is functioning or not. Then accident prevention, it means clear pathways and corridors, clear the pathways and corridors for the preventing any accidents. Use non-slip flooring, use the non-slip flooring in the hospitals. Proper storage of equipment and supplies, properly we have stored the equipment and supplies according to their temperature and their humidity. And also staff training on emergency response. In emergency response, how we want to take the actions, provide the staff training on emergency responses. These are the fire prevention and accident prevention in reduction of physical hazards.
Next one is fault risk assessment. In that first one we check age and mobility issues, then medications like example sedatives, diuretics, then history of falls, then environmental hazards like example slippery floors or poor lighting, and sensory impairments like example vision and hearing. If these things we check the patient after giving a medications to check the patient will fall or not. That is fall risk assessment. In that include age and mobility issue, medications, history of falls, environmental hazards, sensory impairments. Then tools. What are the tools we using? Morse fall scale and Henrich second fall risk model. These are the tools we using the fall risk assessment. Then intervention. Coming under intervention, first one is bed rails and alarm, then non-slip socks and adequate lighting, and last one regular checks on high risk patients. These are the main intervention we do in fall risk assessment.
Our next topic is role of nurses in providing safe and clean environment. In providing the safe and clean environment, what are the roles and responsibilities of the nurse? Maintain hand hygiene and use PPE. PPE means personal protective equipment. Before and after every procedure, maintain the hand hygiene properly and wear gloves, mask and all. The next one is ensure proper waste segregation and dispose. Properly we are dispose and segregate the waste according to the biomedical waste management. We have to dispose every waste and monitor and report environmental hazards. Monitor any environmental hazards is there or not and report it. If anything is there, report it immediately to the authority. Then promote infection control practices. Promote the infection control practices properly in the hospitals and educate patients and family on safety measures. Inform well the patient, educate the patients and family also about the safety measures, what are the precautions you want to take or what are the medications about that, and every safety measures we have to educate the patients. Then participate in quality improvement initiatives. These are the role of nurses in providing safe and clean environment to the patient.
Next one is safety devices. In that restraints, types, purposes, indications, legal implications and consent application of restraints. These are the topics coming under restraints. First one is restraints are measures used to limit a patient's movement or behavior to prevent harm to themselves or others or to facilitate medical treatment. So, restraints are the measures. These are the measures we use to limit a patient's movement or behavior by using to prevent harm to themselves or others or to facilitate medical treatment. That is restraints. Then types of restraints. First one is physical. Physical examples straps and gloves. These are the examples of physical coming under restraints. Then chemicals, example sedatives. Then purposes of restraints include prevent falls or injury. Then protect others from harm. Last one is facilitate treatment like example IV lines, ventilators. These are the purpose of restraints.
Our next topic is indications of the restraints. Patient poses risk to self or others. In sometimes the patient is behavior is changes and their mental health is also changes. That time we have to provide the restraints for reduce the risk of the self harming and harm to the others. Then patient interferes with the medical treatment. Sometimes the patient is interfered with some medical treatment and they refuse to take the medications. That time also we are using the restraints to the patients. Then legal implications of the restraint means use least restrictive methods, follow hospital policy and laws. When providing the restraints, follow the hospital policies and law of the restraints and hospital laws, and document justification and monitoring. Then next one is consent. Before the What are the consent we want to take from the patient? First one is obtain informed consent if possible. If possible, obtain the informed consent from the patient. If the patient is minor or unconscious, we have to take the consent from the patient, family members or any other relatives. We have to obtain the informed consent. Emergency situations may waive consent. In an emergency situation, in an emergency situation or life-threatening situation, that time we don't want to take the consent. Then on the application of the restraints means assess the patient regularly, any changes is there or not. Then use proper technique to avoid injury. Use the proper technique to avoid injury from the patient side.
Next one is skill and practice guidance. In that first one is skill. Under that first point, assess patient's needs and risk. We need to assess the patient needs and risk in the hospital. Then choose least restrictive restraints. Then apply restraints correctly and safely. Monitor patient regularly and document everything. What are the things we do to the patient? We need to document all the things in the hospital settings. Then practice guidelines. In coming under that first point, follow hospital policy and law. Then use restraints as the last resort. Last point, prioritize patient safety and dignity. These are the things coming under practice guidelines.
Next our topic is other safety devices like side rails, grabbers, ambu alarms, non-skid slippers. First one, side rails. Side rails prevent falls from the bed. Use with caution to avoid entrapment. Side rails we are used for the preventing of the patient from the falls from the bed. Then the grabbers means assist patient with the mobility and balance. For the patient mobility and for the patient's balance, we are providing the grabbers to the patient. Next one, ambu alarms. It means alert staff when the patient tries to move or get out of the bed. When the time of the patient is trying to move out of the bed and the patient is get out of the bed, that time an alarm is setting for alert the staff nurses. Next one, non-skid slippers. It means prevent slips and falls on smooth floors. Non-skid slippers we are providing for preventing the slipping on the floors and falls on the smooth floors. That time we are providing the non-skid slippers to the patients. These are our two chapters. Our first chapter is Unit 8, Introduction to Infection Control in Clinical Settings and Infection. In that we are studying the nature of infection and the chain of infection, that all studies. This chapter is the 10-mark questions, 10-mark essay for your exams. Study well the personal protective equipment and biomedical waste management and standard precautions are to study well these questions.
Hand hygiene.
Hand hygiene also. It is also the hand washing definition is asked for your 2-mark questions also it will ask. So study the chapter very well. We are only providing the only short notes we are providing. You have to take the more notes from our Nursing Guru app. Then our next chapter is Unit 10, Promoting Safety in Healthcare Environment. In that we are studying physical environment like temperature, humidity,
noise, ventilation, light, odor, pest control.
These are the things we are studying. In that the restraints, the types are also asking for 2-mark questions in your exam. So if they are asking the restraint definition, you have to write the types and purposes, indications also you can write. It will help to getting the more mark in your exams. So everyone should study well. If you want the more notes, you can check in the Nursing Guru app, and for more updates, you can follow our Nursing Guru channel and subscribe our channel.